So our last talk before the break is going to be from Koekoeckx. That's hard, and I tried to get it right. Thank you. And Ellen has just been such an incredible advocate and asset to joining the FAST family. Ellen really leads FAST Global, and she's here to share with you all of the accomplishments of our global affiliates. FAST is global. That's just what it is. Angelman syndrome is global, and we need to be sure that we represent everybody around the world living with Angelman syndrome. And the efforts that have been undertaken by various regions around the world is tremendous, and we can't underestimate that. And so many people have come here from all over the world to listen to the research. Of course, much of it is being done in the United States, but it's being done to help everybody around the world, not to stay in the United States. And the advocacy and the work that's being done by all of these affiliates should not go unnoticed, and certainly needs to be highlighted, represented, and cheered for. So Ellen is going to share with you some of the amazing accomplishments of each of the affiliates, and I'm really excited to hear all of the work to come to fruition year after year. Ellen.
Good afternoon, everyone. For those who do not know me yet, my name is Koekoeckx, and I serve as a global advisor for FAST. I'm also the proud mother of Hazel, who lives with Angelman syndrome, and it's through her that I became part of this incredible community. Now, for almost 2 years now, I had the privilege of working closely together with our FAST global affiliates. And I must say their passion and their dedication to improving the lives of individuals living with Angelman syndrome and their families is truly inspiring. They are truly the heart and the hands of FAST around the world, raising awareness, supporting families, but also helping to accelerate research. Now, in the next video, you'll hear from the global affiliates as they share their highlights of 2025, but also their ambitions for 2026. Before we start the video, I would like to ask all our global affiliate representatives who are here with us today to please stand up so we can recognize you and thank you for everything that you do for our community. Please stand up so we can see you. It's been an absolute honor to collaborate with this inspiring group of people, and I couldn't be more proud to introduce their work to you today. I don't know if we can start the video or I should start it.
Hi, my name is Shane and I'm the chairperson of FAST Australia. 2025 has been a big year for us in Australia. This year we had Mitch run an incredible 1,100 kilometres in 27 days for Huxley's Hero. That's a marathon a day running from Broken Hill to Newcastle in New South Wales. Mitch captivated the whole of Australia with his running feat, raising awareness for AS and raising $160,000 for FAST Australia. We also held our biannual collaborative conference in Sydney with the Australian partner organisation ASA. Day 1 was dedicated to science, with Day 2 dedicated to educating our AS parents on the day-to-day living with AS. We rounded out the weekend with a gala ball where we raised just over $180,000. So what does 2026 bring for us in Australia? Like the rest of the world, we're really looking forward to hosting some Phase 3 clinical trials. We will continue to build on our AS Clinic program, funding clinical nurses in Melbourne, Brisbane and Sydney. It's an important program giving our families access to our wonderful AS medical experts whenever they need it. And finally, look out for the Global Angelman Syndrome Registry 2.0 in the early part of 2026. It's fair to say we've had some challenges with GASA this year, but we're really looking forward to releasing 2.0 in 2026.
Hello everybody, I'm Charlotte Presta. I'm the Vice President of FAST France. The 2 points we would like to highlight this year, the first one is the mapping of the French community. We have built a map of the French community with nearly 200 registered families. This both helps investigator sites recruit patients more easily and more quickly, while showcasing our community to farmers. The two leverage business intelligence, making it an easy, interactive tool to filter the map by age, genotypes, and regions. This work is thus being replicated within several countries around the world to bring the global AS community in focus. Second topic we would like to highlight is that we have launched successfully the very first research project funded by Fast Friends. This is a study to assess whether eye tracking can serve as a robust tool to measure our children's social perception challenges simply by capturing eye position while watching videos. The study is underway with around 20 children already enrolled, and we hope to share results with you next year. For 26, still like some kind of ambition plan, as we have identified 2 research projects, one on the tau protein, assessing whether it could serve as a biomarker in the context of ongoing experimental treatment, and the second one on e-health, using connected tools to measure our children's sleep difficulties at home. So a lot of projects and hopes for beloved one. Thank you.
Hello everyone, my name is Tom Keogh and I'm the chairman of FAST UK. 2025 has been a great year for us. We have continued our campaign to engage further with the community, which is also one of our greatest challenges. As well as this, we continue to fund the Natural History Study in Oxford, which has now been extended for another 2 years. The study and its findings have been instrumental to bringing clinical trials into the UK. A few highlights of what FAST UK have achieved this year include our annual event at Alton Towers over International Angel Day, which FAST UK sponsor and which gathers families to get together. It highlights FAST as a charity and therefore raises awareness and support from AS families and their friends, with many then fundraising for us. Due to this success, the numbers increase year on year. We ran a media campaign across national radio, newspapers and TV coverage over International Angel Day in February and International Carers Week in June. We launched a successful caregiver survey, obtaining key information as well as reaching out into the community. We strive and continue to make closer connections with other rare disease communities and the Genetic Alliance UK, which we continue to into 2026 as well. We are involved in key discussions about the expansion of newborn earlier screening for AS, and again, we'll continue this into next year. We welcomed a new trustee this year, Sarah Washbrook, who has been instrumental in being involved in 1, reform of the law on disabled children's social care, and 2, transformation of the regulatory approval process for rare diseases in the UK, MHRA, highlighting the strength of FAST UK's voice. For 2026, as well as that mentioned before, we will also continue to push hard to engage the community as treatments get ever closer, to get to know and support pharma companies as we step towards regulatory approval, as well as continuing to engage within regulatory bodies.
Hello everyone, my name is Benedetta Sirtori and I am a board member at FAST Italy. In 2025, FAST Italy moved from the legal form of a charity association to the legal form of a foundation, which gave us a higher consideration and recognition from the government and from hospitals. In 2025, we also organized the very first FAST Italy Scientific Conference. The event gave us the opportunity together with the Angelman community and to reach new families. Also, since the event was highlighted in some national newspapers, we reached the goal to increase awareness. I want to take the opportunity to thank you again, all the speakers who came to Italy. Some of them are in this room right now, and I want to tell you that this was really appreciated by the whole community, and it was really important for us to have you there in person. Thank you again.
Hi there, my name is Noah Firestone and I'm the chair of FAST Canada. The achievements that we're most proud of in 2025 would be our community organized fundraisers, of which we've had great success. And as well, we're just coming to the end of our second year of funding to the University of North Carolina, Dr. Kung's lab, for human-derived stem cell models. The impact of our achievements are great, and it's the reason that we chose this funding in the first place, and that was to support the entire research ecosystem as a whole for bringing treatments to Angelman syndrome. And that is that with these human-derived stem cell models, all researchers that have an avenue towards treatments are able to apply it to this. In 2026, we do have some goals, and that is to have Canada do their part and join in on providing data to clinicians and to pharma throughout the world. So we are in the starting steps of developing a caregiver survey, as well as developing a program to promote and to locate clinicians and physicians throughout Canada to educate them about Angelman syndrome and about patients with Angelman syndrome so that they're best able to direct their patients for best practices.
Hola, I am Cesario Goyanes Duran with the Scientific Committee of FAST Spain. This year has been a very good year for Angelman syndrome research. We gave a big push to research in Spain. First, we added a molecular lab from the government for the first time. Second, we managed to get 2 private universities in one single project that has now been joined by 3 Italian leading institutions in the field of rare diseases. Third, we launched our second grant with 100,000 euros endowment for the winner. Got all these things talking to each other and start collaborating as well. Our second biggest achievement was in terms of fundraising. Just in the first half of the year, families raised over 35,000 euros, family organized events. Also, for the first time, we started participating in corporate social responsibility grants by private companies, and we won our first one. And we are going for 2 more. Maybe at the end of the year, we will have more results on that. For 2026, we plan to have at least 3 active projects, a natural history study, the one on the teeth and the biomarkers, and maybe at a 4th one. In terms of fundraiser, we hope to get a record year in fundraising by incorporating more grants from the corporate sector.
My name is Sarah Gainey, and I'm a board member of FAST Germany. We at FAST Germany look back on 2025 with deep gratitude. Thanks to support of our community and dedicated celebrities, we were able to raise 131,381 euros through our fundraising campaign. With these funds, we've been able to secure financial support for our 3 Angelman clinics in Germany for another 5 years. This enables our doctors on site to conduct their own Angelman research, a valuable step that helps strengthen the Angelman research in Germany. We are also proud that Germany is now actively involved in several clinical trials focused on Angelman syndrome. Each of these studies brings us closer to our shared vision to one day find an effective treatment for our loved ones. On behalf of FAST Germany, we say thank you for your trust, your generosity, and your hope. Together, we're making real progress for the Angelman community.
My name is Karolina Pospieszyńska-Martysiuk and I'm the chairperson of FAST Poland. This year was breakthrough for our Polish community. For the first time in the history, clinical trials of a potential therapy for Angelman syndrome has started also in Poland. Thanks to strong collaboration with medical experts, industry partners and our community, Polish families can now actively take part in this global research. FAST Poland, together with Medical University of Poznań, launched the first national cost of living with Angelman syndrome study. It shows a real AS burden for families, caregivers, healthcare system, and society. It will be a powerful tool to advocate for access once therapy is approved. We celebrate International Angelman Syndrome Day with a conference between dreams and reality. It brought together medical experts, parents, and therapists to share knowledge and hope. In 2026, we will continue to advocate for our community and raise awareness so that no family has to face Angelman syndrome alone.
Hi, my name is Stephanie Azut. I am the president of FAST Latam, and I am the mother of Michelle who lives with Angelman syndrome. 2025 has been a year of important achievements for FAST Latam. We have successfully completed the data analysis for our cross-sectional patient study, which included 90 patients in 3 different countries. This has given us valuable insights into the clinical characteristics of Angelman syndrome across the region. Also, in collaboration with FAST Poland and FAST France, our Caregiver Impact Survey has become a very powerful tool to better understand the perspectives of families and the unmet needs they face every day. Looking ahead, 2026 will be a very important year for us. We are thrilled to announce our second Latin American Angelman Syndrome Conference, which will take place in Mexico City on April 30th and May 1st. This event, once again, will bring together families, researchers, clinicians, and industry to accelerate progress across the region. Everyone is invited, and we hope to see you there. Beyond the conference, we'll also continue building community through International Angelman Day activities, raising awareness at different medical regional conferences, and expanding our fundraising campaigns like Mi Sonrisa Favorita or My Favorite Smile, and participating in major sports events, including Bogota's Half Marathon. Together, we are proving that Latin America has a strong and united global voice for Angelman syndrome. Thank you.
Thank you so much. A huge thank you to all our global FAST affiliates for everything you do, and it's just incredible to see what we can do as one global community. Now, we're up for a break, so I would like to ask you to come back in 10 minutes for the abstract lightning rounds, where you will ask you to vote for the best abstract you will see after the break. Thank you.